I am Dr. Indu Khosla. I am the pediatric pulmonologist here at the NH SRCC Hospital for Children in Mumbai, which is managed by Narayana Health. Today I am going to touch upon a topic on nutrition in children with cystic fibrosis. And Dr. Roshan Kore, who is our chief dietitian here at the NH SRCC Children's Hospital, will join me shortly. Why is nutrition important in children with cystic fibrosis? In fact, this is the pillar on which their health depends. We know that the reason why these children are malnourished or they do not grow is because they lose fat and protein in their stools. This occurs because of lack of enzyme called the pancreatic enzymes, predominantly the lipase, the protease, which are not secreted into the intestine as the thick mucus blocks the duct of the pancreas. Hence, whatever these children eat either is malabsorbed and it's thrown into the stool, or it's just not completely absorbed. Because of this, they do not gain weight, and hence when they do not gain weight, they are more prone to infections. They're as it is prone to infections because their lungs are blocked because of thick mucus, and when they are malnourished, they are further immunodeficient or they are poorer in immunity, and therefore they get more and more infections. So these children require high protein, almost 2 to 3 times the recommended dietary allowance of proteins, calories, fat, vitamins, fat soluble vitamins, which also don't get digested because of the problem of the deficiency of enzymes in their intestine. All this has to be supplemented from outside. Apart from this, they need enzymes to digest whatever we are giving. So we need to give pancreatic enzyme, which is called as pancreatic enzyme replacement therapy, which has to be given. In younger babies who are breastfed, we need to give approximately around 2000 international units of this pancreatic enzyme per 120 ml of milk. As they grow older, the calculation is done based on the fat content of their food. So approximately you need 10,000 international units of pancreatic enzymes per 3 to 5 grams of fat in their meals. Approximately, if one has to calculate, the upper limit of dosage is 10,000 international units per kilogram of body weight, but that's the upper limit. It needs to be monitored based on the child's weight gain, based on the child's frequency of stool or presence of oil in stool. So each child may have a different requirement of the pancreatic enzymes. What is important that these enzymes are available in a capsule form, and inside the capsule there are microspheres which are coated, and these have to be delivered into the intestine. Since small children cannot take them as a capsule form, these capsules are opened and they have to be given to children in such a form that it goes unscathed into the intestine. So these enzymes have to be coated so that the child it can reach and not be destroyed by the acid in the stomach. It has to be given mixed with either say apple puree, a little bit of honey, and it should be given as the child starts consuming a meal. So once the child has consumed 3 to 4 scoops of any meal that the child is consuming, this dose of pancreatic enzyme, which is coated in either honey or an apple puree, should be given so that it acts on the food that the child is eating. Once you do this, and along with the diet which Dr. Roshan Kore will suggest to us, these children can do very well, and they can lead a better quality of life considering the fact that they have cystic fibrosis. Thank you.
Hello, I am Roshan Kore, pediatric dietitian at SRCC Children's Hospital managed by Narayana Health. Today we are discussing about the topic nutrition for cystic fibrosis. We all know that children with cystic fibrosis have increased requirements for calories and proteins along with other nutrients, because as Dr. Indu has explained, they are not able to absorb whatever is getting provided to them. So let's see how we can improve the nutrition content of the food. First is the calories. To increase the calories in the diet, fats, which are a major source of calories, giving 7 kilocalories per gram, are our first thing that we go to. Fats can be included in the form of butter, ghee, oil, MCT oil and coconut oil for cooking as well as drizzling over different preparations. Second is including nuts and oil seeds like groundnuts, coconut, cashews, pistachios, etc. in preparations like porridges, salads, fruit salads, and thereby increasing the calorie and protein content. We can also ensure that the child gets enough calories by making preparations with more than one food ingredient, so that there will be all the other nutrients along with calories and proteins. Good example for that is something like a paratha, which can be made using a wheat flour as well as a cheese or paneer and vegetable mixture. So you get a balanced diet in one meal. It is important that the child with cystic fibrosis gets concentrated meals because their appetite is very poor. So you need to give foods which are prepared in concentrated in nutrients like calories, proteins, fats, fibers, everything together. You have to understand that a child, when a baby is born with cystic fibrosis, the baby would be on breastfeeding. At the age of around 4 to 6 months, weaning or complementary feeding needs to be started. If the child is growing well, weight gain is proper, the introduction of complementary feedings can be delayed up to 7 months. But if the child is lacking in weight gain, we need to introduce concentrated foods before that. We have to remember that a baby is ready to eat soft foods at 7 months of age, and we start with soft foods like soft upma, halwa, khichdi rather than giving liquidy gruels and thin kanji. When we are making these soft khichdis, we have to start with one food at a time, introducing just a rice or a moong dal at one time, and then slowly progressing to other food grains and other vegetables and fruits. Give time for 4 to 5 days to digest and tolerate one food, and slowly and steadily you will have a whole range of foods which the child can start eating. Then start by combining these foods together to make a complete balanced meal in one bowl for the baby. Porridges like which have sattu atta or wheat atta and other millets can be prepared in milk instead of preparing in water. They can be concentrated by adding a teaspoon of ghee or a dollop of butter. Adding sugar, jaggery, dry dates powder can further increase its calories. That way, a small bowl of porridge is having all the goodness of the nutrients that a child is requiring. Then you can also move on to introducing non-vegetarian foods like egg and chicken by the time the baby is 8 to 9 months old. Introduce one small thing at a time. Check for intolerance. Don't panic if there is a little bit of change in the stool structure. The baby will take a little while to get adjusted to the new foods. Adding eggs and chicken to different meals will further enhance the protein content. The child also needs multiple vitamins and minerals, especially the fat-soluble vitamins, which are available in dairy and non-vegetarian foods. So, introducing dairy and non-veg is a must for children with cystic fibrosis. When the child is ready to eat soft foods and has all the different flavors and different foods introduced, you move on to solid foods by the time the baby is teething. That way, you will achieve a goal of providing the child a full meal at age 1 year, so that he can have a thali of food where all the different foods that an adult would be eating are introduced. But remember that you need to keep the portion size small and concentrated. When the older children are having cystic fibrosis, and that is when you have to think about the growth. So, to ensure that the child is growing well, make sure you are introducing all the different foods. We can add fats in a form of snacks. Snacks like chips and wafers may not be advisable for generally for children, but small portions of this can give a load of calories and salt to a child who has an increased demand for these things. Also, things like cheese and paneer have high calorie and protein value, and a thing like a pizza, which is modified to add some sprouts, more cheese, more paneer and a lot of vegetables in the gravy, can be a good source of snack for these children. Introduce sweet preparations like porridges, halwa, laddus, chikkis, because they not only have sugar in it but also have fats in the form of ghee, nuts also provide with proteins, and the grains will provide with the fiber and the calories. So, traditional Indian preparations can be a good source of nutrition for our children with cystic fibrosis. As the child goes to school, make sure the tiffin preparations are easy to eat. Something like a wrap is stuffed with protein-rich foods like non-vegetarian and paneer and dairy and sprouts can be easy for a child to hold and eat, and one bite will give all the wholesome of nutrition that is required. So, a balanced diet is the key to provide concentrated energy, protein and nutrients to the child with cystic fibrosis.